You've affected millions of people's lives in mainstream America and around the world, and I just deeply appreciate you for all the time and energy you put into this.
Well, you have as well, and you've trained members of my family, so I'm appreciative.
We look at our graduates and we want to help bring them into the healthcare system. They have so much to offer. The system is so broken. What do you feel is the best way to do that?
We as a nation need an extra layer of caregiver between folks who don't feel well and the healthcare system. And instead of trying to change the healthcare system to do something that it's not really designed to do, I think this layer could provide the insights required to make all of us smarter patients. So we feel more confident asking the questions, sometimes uncomfortable ones like, can I get a second opinion? Which we know changes your diagnosis, your therapy a third of the time. I mean, it's a very patriotic thing to do, right? It's very altruistic. You're asking questions on your own dime, getting an extra opinion, and that extra opinion can often affect the first opinion, letting that doctor become a better doctor for the rest of their career, taking care of patients much more effectively. Who's going to get you to be comfortable asking that question? The people that you're training and that level of caregiver can allow that to happen more effortlessly. I imagine a world where for a fraction of the cost of going to see a specialist for a headache, someone can give you advice, basic advice, but very valuable advice on how you can avoid the problems in your own home. And instead of trying to fight the battle in Washington or our state capitals, let's fight it in our kitchens, our living rooms, and our bedrooms. Let's have the conversation in a place that's safe enough that we begin to implement them much earlier. And Joshua, I'm always reminded of the conversations I have with my patients when they sit in their chair looking right at me. There's two things they can say to me when I give them an option. If I say, well, we can do a heart transplant, they say, do I have to? Or I say, well, you can take some more omega-3s, it'll help you. They say, well, yeah, why not? You want why not answers. And the kinds of advice that generally this level of practitioner will offer will be why not answers. But you'll be making it easier to do the right thing by giving tools to people that they can actuate in their own lives under their own control.
So maybe like a university accreditation, like a degree, something like that?
I think a university accreditation would be nice, and I don't think it needs to be years and years of training. Ideally, it would be a very affordable tuition so that people can actually do it while they're practicing whatever their day job is, and then use this as a tool to grow who they could be in life and play an active role. So if the accreditation, let's say, was done in a 10-month course, less than a year, was subsidized or affordable, made accessible for that reason as well. And what was taught, the core of it, basic nutrition, understanding of the different herbs, nutrient supplements, things that I don't know and didn't learn in medical school until I started my show. I actually had to go back to scratch and figure it out again. Those are kinds of insights we want them to walk away with. I'd want, as a patient who doesn't feel well, to be able, in one visit, to get a much better perspective of what life could look like if I dealt with this. And for someone to give me real tools, action steps that day that I can use to feel better immediately, but also so easy and understanding of who I am and what I can afford that I could actually use that my whole life. That changes the whole game plan, as opposed to the one-off episodic visit where you visit a specialist, they say, you know what, you're gonna die if you don't fix this, so fix it. But they don't quite tell you how to do that.
Well, it's either a pill or an operation.
Well, pills are very fast to prescribe, and we're taught how to prescribe them. And people come visit us all the time and tell us what to prescribe. Operations we get paid very well with. So it's like an IQ test, isn't it? If you're a smart person who's gone through medical training, you'll do what reimburses quickly and has proven because you can invest tens of millions of dollars to prove that it worked, outcomes. And it takes outside forces to hold smart people from doing things that maybe aren't the best for their patient. And although we all take the Hippocratic Oath and we're all proud that we're doing our best, we're all good at lying to ourselves too. The smarter you are, the better you are at telling yourself stories that defend actions that in their purest form would be harder to defend.
And also for the insurance companies or the self-insured corporations, if they could see a health coach pay $25, $50, and they're going to save so much money down the road with much higher expenses.
Well, without question, as soon as you start having accredited health coaches offering advice that dramatically changes the lifestyle of the 20% of people who drive most of the healthcare costs. It's a classic 80-20 rule. 80% of people are doing a lot of these things or enough of these things, they don't have an issue. The 20% who are sick desperately need the health coaching. Let's focus on them. Let's keep them out of hospitals, feeling better about life, losing weight, stopping cigarettes, whatever the things they actually want to do. It's like hypnosis. You never hypnotize someone to do something they don't want to do. You get them to do things they want to do already. You just show them how to do it without the struggles that often are accompanying it.
So in a way, you're saying that the special training should really focus on the 20% who are the main users of healthcare expenses.
With the extra knowledge, they'd actually be able to share their vision and insights. Simple things, by the way, could be hugely effective. How do you find the right doctor? Who's the butterfly that runs around from flower to flower and connects all of us so that we know which ones are the best flowers to visit? Those should be folks who are graduates of programs like yours with an appropriate accreditation, so we know they've gotten a fund of knowledge. Part of the challenge is that by nature, people who are attracted to this field want to be themselves. They don't want to have to fit into a very narrow little round-sized peg hole, because they're squares. And I think although we desire that freedom, it hurts the field in many ways. Without organizing and some way credentialing what you're learning, no one knows what they're getting, and it holds the field back. And I look at herbs as a good example. People who really understand herbs are hard to find, and I'm never quite sure who really knows about herbs, but I know herbs are hugely beneficial from numerous studies. How do you give people advice about which ones to trust when you can't even find the right person to get advice from? Everyone can benefit from health advice. I mean, the healthiest people I know will once in a while have a little question here and there, but they're not the ones who you can prove financial benefit with.
Right.
The ones where you'll see the biggest return for our environment. And I'm worried because those 20% are growing. They're actually becoming more than 20%. And it's very difficult to imagine a healthcare system that can afford to provide some of the very high-tech testing and treatments that we often use without a lot of confidence that they're going to make a material difference. There are many things we do where we buy you a couple extra months, of what we think is quality life, but I'm not even sure it's all that much quality. I think the conversation ought to be shifted to how do you feel better now, today, so that every day for the rest of your life you enjoy it more. That's why oftentimes I challenge people to tell me what percentage of who you could be are you right now? Are you living at the 20th percentile of life? Are you at the 60th percentile? I mean, would you be happy with a D in life? Don't you live at 90th percentile of who you could be? Listen, 99th percentile, Olympic athlete quality, we're not going to get there, most of us. And we have other things we have to do in our life. We may not want to do that. But living at 90th percentile feels really good.
Yeah.
And when you lose that, you can slip away and you blame yourself. It's like a spiral, a death spiral, literally and figuratively.
It's really been wonderful talking with you today. I appreciate your being here very much.
You're very kind, Joshua. Stay well.
Thank you. You too.
On a daily basis, pay attention to a few things: good sleep, healthy, loving relationships,